Greetings, everyone. My name is Dr. Justice Masilela, and by qualification, I am a veterinarian. I'm currently doing my community service in Gauteng. And yes, so I've been getting a lot of questions around, rabies. People asking me a lot of questions around it. So I decided to make this short clip just to maybe give a few pointers as to what is rabies, and what is it that we need to know about it. Basically, rabies. I don't want to bombard you with a lot of science and basically rabies is believed to have came from bats, and some believe it comes from wild dogs, and for some reason it ended up being in our domesticated dogs. And human can get it from dogs, from interacting with dogs from a pet level, or from being bitten by a dog, which is the most common way of getting the disease, by being bitten by dogs. So in you see, in cases in rural areas, being bitten by a dog is an everyday thing. We all know about it. People get bitten by dogs, and it's not a train smash. It's not a problem. I mean, it's not something new. People have been bitten by dogs before, and even today they are. Well, it is something to be taken serious to be bitten by a dog. If a dog shows aggression for no reason, that's not a normal behavior of a dog. A dog is not supposed to show aggression for no reason. That's not a normal behavior that we should accept. So yes, because that also is one of the common symptoms of a dog that is infected with rabies. Not that every dog that shows aggression is infected with rabies, but it's one of the signs or symptoms. There can be a lot of things that contribute to a dog being aggressive, ranging from how it was raised, the environment, and all of those things, and maybe it had some traumatic experience in the past. It can contribute to a dog being aggressive. So yes. So, but it is one of the signs, and being bitten by a dog should not, or an aggressive dog should not be accepted as a normal behavior, because it's not normal for no reason. Yes, if maybe you aggression is usually a defense mechanism of a dog. If a dog feels threatened, or feels like it's in danger, it needs to retaliate or protect itself or protect its puppies or whatsoever. It does become aggressive. So aggression alone is not the thing that indicates rabies alone. If it stands alone, it needs to be within a lot of other factors that contribute to us making that decision that this might be rabies. But aggression and being bitten by a dog should not be taken lightly. So what happens when a dog bites you? Well, the virus, on its later stage within the body of a dog, it infects the dog's salivary glands, and thereby infecting the saliva of the dog. And when the dog bites you, the dog infects you with the saliva. So the virus is in the saliva, and then you get infected from that, and the virus begins to replicate around the tissues where the dog has bitten you. And from there it moves up through your peripheral nerves into your central nervous system, basically your spinal cord. And then from the spinal cord it moves up to the brain, where it causes an inflammation, or what we call an encephalitis, which is often fatal. Once it gets there, then there's nothing that can be done, because that's like the end stage of from there it also moves and infects your salivary glands and other organs within your body. And we are having issues. But maybe to point out first signs to look out for when you are maybe bitten by a dog and the dog has infected you with rabies. Things that you can see is fever, anorexia, which is maybe loss of appetite, headache, pain, and numbness around the site where you were beaten by the dog. This can then move to neurological signs where you find someone has anxiety, is paralyzed. Yes, it can cause paralysis, and you tend to be scared of water. Basically, it affects your nerves, cause your nerves to dysfunction. Therefore, you can't really, your swallow reflex is lost, and you find it difficult to swallow things, and often you find it difficult to swallow water. Then you begin to have this condition called hydrophobia, which simply means to be scared of water. But you're scared of the water, you don't want the water, or the dog is usually scared of the water, because these signs are also seen in dogs and other animals that are infected. Yes, so you can't really swallow, so you don't want to do with anything that has to do with water because of that. And it moves to hallucination. People hallucinate, and then the later stage, which is death. And once it gets to the once you start showing neurological signs, there is nothing that can be done. Basically, you're just going to deteriorate and reach the end stage, which is usually death. But there is something that can be done if someone is beaten by a dog that has rabies. Basically, for every bite that you can encounter, if you get bitten by a dog, one thing, standard rule that you should do, first thing, you must take being bitten by a dog serious, and make sure that every time you get bitten by a dog, even if you don't really suspect, but because now you are awakened by this information that I'm dishing out, that there is something called rabies out there, and you know about it, and you get it from being bitten most of the time by dogs. You can get it from petting, because it stays in the saliva, touching the dog and doing everything, and being licked. And when you have also a wound there, and the dog happens to lick your wound and all that. But yeah, you can get it. But the most common way is being bitten by a dog. And yes, so there is something that can be done. There is no really treatment or medication that is there scientifically proven to heal rabies, but there are means that can be put in place to try and treat someone who has been infected or who has been exposed to rabies, which is vaccination. So if you get bitten by a dog, simply run to your nearest tap, open the tap, let water run, and you wash the wound, preferably with soap water. You rub and you wash it thoroughly. Or if there is no soap, you can wash it with just water. Do anything that may contribute to saving your life. Just wash it thoroughly, rub it with the water, and if there's soap, with the soap, and then you quickly run to your nearest clinic or doctor or hospital. Some clinics do have this vaccine, some do not have it. And yeah, you need to be on a course of vaccinations, which is going to be 4 doses. You're going to get one on what we call day 0, which is the day which you got beaten by the dog, or the first day of being injected with the vaccine. That's going to be your day 0, and then you're going to get another dose on day 3, and you're going to get another dose on day 7, and the last one on day 14. In immunologically compromised patients, they usually get the 5th dose on day 28. Yes, but yeah, that's specifically for the immunocompromised patients. Yes, and there is what we call rabies immunoglobulins, which can also be added as part of the treatment. Basically, a vaccine stimulates the body to produce what we call antibodies. But these rabies immunoglobulins are ready-made antibodies that can be, injected in usually on the site of the infection where the dog has bitten you. That's where the immunoglobulins are usually, put in. And yes, basically they have immediate effect, whereas the vaccine itself has a delayed effect, where it needs to stimulate the body to produce its antibodies to fight the rabies in you. So this needs to be done as early as possible. And please make sure that, for instance, if you're bitten on your right, the vaccine is not given. Firstly, it must not be given at all on your bum, on your buttocks. It must not be given on your bum. It must be given here on this muscle on your shoulder. If you maybe for instance you've been bitten on your leg or on your right hand, it must be given on the opposite side. So it must be given on this other side. If you're bitten on this other side, it must be given on the other side, the vaccine. And yes, that's all. Basically, the take-home message would be: let's not take light when we are bitten by dogs. These things can be prevented, and yes, there are means that can be done if the dog had rabies, or you've been infected in any way with this virus called rabies. There is means to try and save your life and save you and save your life. So do something about it. Go get those rabies and those immunoglobulins, and be safe. But the biggest thing that I'll probably also need to make a video on is vaccinating our dogs, because there's what we call One Health, where the health of the animals, the health of the environment, and the health of human, they are a closed system that interacts with one another. So if you protect your dogs, you are ultimately protecting your health. Like for instance, with this disease called rabies, you need to protect your dogs. You need to vaccinate your dogs. Make sure your dogs are healthy and they don't have the disease and are protected against the disease, so that ultimately you protect yourself from secondarily being infected by the dogs which have got the rabies. So that One Health concept is very much important, and we'll go into it and expand from there. Thank you for today. That's all that I have.